Hello, everyone, and welcome to HLTHPS007, Administer and Monitor Medications. Acknowledgement of country. In the spirit of reconciliation, Meditech Training College acknowledges the traditional custodians of the country throughout Australia and their connection to land, sea, and community. We pay our respects to the elders past, present, and emerging, and extend that respect to all Aboriginal Torres Strait Islander people today. The objectives for this presentation will talk about the handling of medication contingencies and also completing medication distribution and administration. Now, how do we report medication refusal or inappropriate ingestion, incomplete ingestion to supervising health professionals? First of all, we need to define what incomplete ingestion means, which is when a medication administration was incomplete since the client hasn't taken the correct dose or medication. This can be caused by inability or difficulty in swallowing medications, injection of medication, vomiting, and medication refusal. Medication refusal means that the client does not agree to the medication, and every client has the right to refuse medication. However, it's important for you to report to your delegating health professional. Things you need to do though is to observe the client for any physical or behavioral changes. You need to observe the client to know if they're displaying any signs of withdrawal. You need to find out the reason why the client doesn't want the medication, and you need to explain the consequences to them. You need to determine if the client is suffering from any adverse or acute issues. You need to also seek advice from your health professional. If half an hour or more passes since the client missed their medication, you need to document this as a medication incident. If the client refuses their medication, you need to work within your responsibilities or your scope of practice, and you need to report this to the delegating health professional to review the client's treatment plan. And finally, you need to record the outcome of the situation, including the reasons for refusal. Medication must not be contaminated or expired when administering. Medication may become contaminated due to human error or environmental causes, and these contaminants include dust, dirt, fungi, microorganisms, bacteria, viruses. Expired medication are also known as out-of-date medication, and both of them are classified as pharmaceutical waste. When you're disposing of medication, make sure it's safe, it's disposed safely, and also in the appropriate manner. Expired medications and contaminated medications are disposed the same way. When you're disposing of the medications or when you see an expired or contaminated medication, please do not use the expired or contaminated medication. Do not administer it, in other words. Dispose of it immediately. Do not place the contaminated or expired medication do place it in a secure container. Always document the disposal of the medications, follow infection control procedures when disposing of the pharmaceutical waste, and return the contaminated or expired medication to the pharmacy nearest to you. All right. It is important to be vigilant after you give a medication to a client. Observing is gathering information using any of your five senses, and you must also collect the information so that you can report accurately to your delegating health professional. All right, how can you do this? You need to be familiar with the client's baseline condition. You need to check in with the client regularly. You need to know the purpose of the medication that you're giving. You need to look out for signs of acute and adverse reactions. You need to look out for signs of anaphylactic reactions. You need to acquire information from the pharmacist or from the medication website, if there's any, and you need to record any changes of the client's condition. Be accurate, factual, objective, and record the outcome, whether it's good or bad, or positive or negative. All right. You always need to be vigilant. Again, always record data accurately and also rectify inconsistencies immediately. Remember to review and report these inconsistencies according to delegations and organization guidelines and procedure. Now, how can you do this? You need to prepare the information you've gathered when you recorded the client's information. You need to make sure the information you have is accurate and objective. You need to set a meeting with your supervisor and the relevant delegates and health professionals. You need to relay this information with the client's condition, about the client's condition. You need to listen to your supervisor and relevant delegating health professionals' instructions. You need to clarify with them and ask questions about their instructions. Then finally, you need to apply those instructions immediately after the meeting. All right, these are possible documents that consist or contains inconsistencies. We have the care plans, we have delegation instructions, we have medication files, we have medical charts, we have medication orders, prescription, progress notes, medication records, and incident reports. Very important for you to rectify these inconsistencies because it will help both your supervisor, health practitioner, or delegating health practitioner, and also others to understand what has happened. All right, by reporting the inconsistencies, meaning bringing or sending your records to the supervisor and the other um, delegating health practitioners, relevant health practitioners would be anyone involved in the client's medication and treatment. Prepare the information related to inconsistencies found in the documentation. Check the records or the recorded information to ensure that it is accurate and objective. Create an email correspondence with the necessary information. Send an email correspondence with inconsistencies to your supervisor and the delegated health practitioners. And check your invoice regularly for any additional instructions that they may have. All right, manage medication equipment and used containers according to infection control guidelines. Okay, for aprons, which I'm sure you know, check aprons and gowns or change aprons and gowns anytime you leave a client's room. Dispose of it if it's a single-use plastic apron right away. Um, Store unused aprons in an area away from potential contamination. Take off your apron before leaving a client's room to prevent the outside areas being contaminated, and roll over the apron, making sure that the contaminated side is turned inward. Gloves. Wash your hands before and after using gloves. Um, Change between clients or after each procedure. Wear gloves upon entering the client's area and remove them from leaving the area. Remove damaged gloves. Remove gloves when you need to wash your hands, and um, only utility gloves used for cleaning and house clipping can be reused. For containers for dry spoons, dishes, and tumblers and water pitchers, you need to make sure you wash this in the dishwasher if it's a low infection risk situation, and need to use disposables if it's in a moderate to high high risk situation. The following is a list of also medication equipment on how to manage it. So we're talking about the key to medication trolleys and cupboards. You need to make sure that they're cleaned regularly. Make sure you're doing it with clean gloves when you're cleaning, and make sure that you do not place the equipment back into the trolley or in the cupboard if the equipment are not dry yet. Measuring cups and spoons, you need to clean before and after use. Peel crusher, you need to clean once a week and make sure that you clean the areas with a brush, especially the areas that cannot be cleaned properly without a smaller equipment. Nebulizer, clean before and after use. Um, Use detergent, but also get information from your organization because every organization has different ways of doing things again. Sorry, oxygen cylinder. Clean the cylinder body before use, and do not use disinfectant or clean it or cleaners on the opening. The mask should be cleaned once a week with warm soapy water. You need to make sure you rinse thoroughly and replace every month or when broken. The nasal prawns needs to be cleaned every day with soapy cloth, and replace nasal prawns once a month or if discolored or cracked. Preloaded dose administration aid for insulin. You need to make sure that only one insulin or needle is used for a client. Tablet divider, wash in warm soapy water and rinse thoroughly, and always clean between use. And tea towels, wash frequently to prevent bacteria from accumulating. Now, here are ways that you can also manage containers. Use containers to prevent infection. Um, to prevent infection, so you need to restrict use of this containers to one client. Do not combine leftover contents with each container into one, even if the medication is the same. Check the manufacturer specifications for when the container should be discarded. Store in a secure area where the unauthorized personnel cannot access this. Place this and other sharps in a leak-proof, puncture-proof, impervious container. Discard single-use containers at the end of each procedure according to your organization's procedure. All right. After completing administration, another task that you need to accomplish is to check the DAAS or DAAs and supplies. You may need to replenish this at a specific point. But just to get more information about that or how to complete arrangement and procedures to replenish what you need to check or conduct regular supply checks. You need to do this weekly. You need to regularly check the medication, the DAAs, and also other supplies for damage or contamination. You need to schedule when you need to acquire medications. You need to know which medication is prescription and which doesn't. You need to know what pharmacy to acquire the client's medication from. You need to consult the clients, their carers, and the relevant delegating health practitioner regularly. And finally, you need to document medication and supply requests in the medication chart. All right, storing medication documents according to the organization procedures. In order to safely store medication, safely store medication information, you need to do the following. You need to store the physical files where you can protect them from physical damage. You need to store digital files in the correct folder based on the organization system. You need to make sure you remember where you put those files. And finally, you need to make sure you keep those files where it remains confidential. Okay, here are general rules or procedures when storing medication. You need to make sure medication is stored in a dark, dry, cool area that unauthorized personnel cannot have access to. You need to get it stored in the original pack. This helps others to know what medication it is. It needs to be kept out of reach for children. You need to um, bring all unwanted medications back to your local pharmacy. So you need to send it back to your pharmacy. You need to also know your storage procedures in the organization, um, and also know that most used medications can either be tablets, capsules, or liquid medications. So making sure that you know the proper way of storing all those medications. All right. So here we'll be talking about the following table. Well, is a list of storage procedures you may have to consider if the client uses the following forms of medications. So inhalants, these are for metered dose inhalers. They should be stored in an upright position. Lotion, creams, and ointments needs, the lids and the cap needs to be tightly closed. Patches do not open the patch unless you're ready to apply it. Wafers, do not open the package unless you're ready to administer the wafer. Um, Tertiary and suppository. At times, if this is a form of tablet or capsule, it needs to be refrigerated. Or again, you need to read the instructions on the medication package. These forms of medications must be firm before it's inserted. Okay, sterile medication according to the legislation. The legislation on medication storage can be found in the standard for the Uniform Scheduling of Drugs and Poisons, which is also known as SUSDP. Generally, across schedules, medications are supposed to be stored properly. The general rule is to store medications in a cool, dry, and dark area. Aside from this, making sure that you work within your role responsibilities. To do this, you need to make sure that the base storage procedure is based on the following. So on CMI, which is the consumer medication information, the pharmacist's advice, and the prescriber's advice. Um, just remember when you give a medication, you just make sure you do not modify the storage procedure instructions. Do not skip any of the storage procedure steps and ensure that you have understood or you understand the medication storage procedure and instructions entirely before proceeding. All right, we're back to what we've learned for the day. So we've learned how to report medication or refusal or incomplete injection to supervising health practitioners according to the organization's procedure and protocol. It's also mentioned or also clearly identified contaminated or out of dose medications and how to implement organization procedures for safe and appropriate disposal, how to observe and record changes to the client's conditions, how to record any report of inconsistency according to the delegate and also the organization's guidelines and procedure. Then down to 7, we've learned how to manage medication equipment and used order according to infection and control guidelines, also how to complete arrangement and procedures to replenish the AADs or administration aids and supplies. We've also talked about how to store medication charts, care plans, um, treatment sheets according to the organization procedures, and also how to complete medication storage procedures in compliance with legislation and your own responsibilities. All right, so the next slide is what to do next. You need to complete your case studies. You need to book for a one-to-one meeting with your trainer so we can book you in for your assessments, for your role play, I mean, and you can also book for a one-to-one in case you have questions for your assessment. When saying that, thank you for watching and have a lovely day.